reasons why I came to Dr. Bolton is that I did my homework and I did some research and I looked at the other doctors and the more well-known names that are out there that are commercialized, and I wanted to feel the service, the quality of a professional. I didn't want to go somewhere where I was just a number. And here, I feel like I'm at home. I feel warmth. I feel compassion. I feel that they generally care. So I'm looking forward to my procedure and the results. And I honestly believe that Dr. Bolton and his staff is too.
The first half you're kind of like this,
okay.
And then the second half you're going to be laying back, supported with a headrest. A lot of patients take a nap.
We just harvested the donor here. What we did was we pulled out 33 square centimeters of hair. If you take a look over here, you can see the two strips. And what's important about these strips is when you harvest it, is you want to make sure to not cause any transection on the follicles. Now if you take a look here, you notice all the follicles are intact. Now that's extremely important because the more you transect the follicles, then the less hair you'll get. So it's extremely important to get a perfect harvest and minimize the amount of transection. And so I want you to really take a close look at that. And just zoom in and show the two strips and how there's no transection.
Discomfort?
None. Awesome. Very comfortable. We're having a good time. Just sitting here, relaxing, very content. Doc, you make it look so easy.
Thank you, sir.
What's the size of the strip that comes out? It's like 1 inch thick?
It was 33 square centimeters. So 33 centimeters by 4.
Wow, very cool.
Right. So remember that whole huge piece?
Yeah.
That comes out. That goes
Look
down.
at that. You don't even see it at
over.
all. That's cool. Don't even see it. Wow.
Okay, we've completed harvesting the donor. The suture site is closed up. The technicians have finished dissecting the follicles into what I've asked for. We've cut them up into separate types of grafts, which are composed of 1 hair grafts, which are micrografts, which go in the very front of the hairline. Then we use the follicular unit behind that. The follicular unit is a naturally occurring bundle of hair. You might have anywhere between 2 to 3 hairs based on the density of the individual's own follicular unit. So the frontal hairline is all done with that one tiny little hair at a time, and that's what makes it super soft and super natural. As you can see, that little black dot at the bottom That's the bulb of the follicle. That's what's going to grow the hair. The tip of the graft will stick out, it sheds itself out, and then that little bulb will grow the hair in 3-4 months. Mostly every doctor who does hair transplants will do what's called a follicular unit hair transplant. The follicular unit hair transplant is composed of either these 1 hair grafts or these 2 3-hair grafts. If you look at this graft, you'll see those 3 little dots. Those 3 little dots means it has 3 hairs in it. This is a 2-hair follicular unit. This is another 2-hair follicular unit. Okay? So these follicular units will go behind the 1-hair grafts to make sure it looks soft and natural. That's a 3-hair follicular unit. Okay, so this is what every hair transplant doctor will use. What I do differently than everybody else is I use a graft that's called a multiple follicular unit graft. So now my graft will have 2 or 3 of these naturally occurring bundles in it in one graft. So now if you look at it from this angle, you'll see all the different follicles that are in there. I'm going to hold it up for the camera. You can see it from the top. So there's 2 or 3 of those bundles in there. So when you look at it from underneath, you can count the little black dots. 1, 2, 3, 4, 5, 6. This particular graft has 6 hairs that are visible to the eye. There could also be another hair or 2 that are in there that might be in a resting phase that we're unable to see. These still will go into a little slit graft, so to a paper cut incision, so that way they're super soft and natural looking. So it's not to be confused with the older style plugs. So you can see the difference that these multiple follicular unit grafts give in comparison to just the micrograft or the follicular unit alone. The more graft is cut, the more of a chance you can cause transection. A graft can be transected when it's cut because the follicles obviously grow in a straight, and sometimes they might have a little bit of a curve to it, and they're very difficult to cut sometimes. So for example, when you're cutting a graft, you might have a hair that's in the resting phase. For example, if you look at this, you see how this hair goes straight, and then this little hair, it's hard to cut that without transecting that follicle. So the more we keep the follicle intact, the less we'll lose hair, and the more hair we get for the patient. This is just local anesthesia. We're going to do the ring back around the front. So when we're making the recipient sites, I use different sized instruments for different sized grafts. What we'll do is we'll set the instrument to the depth of the follicle. So that way we don't cause any extra damage. As you can see, the follicle is a perfect match with the instrument. So that way we don't go any deeper. So that way we don't cause any structural damage. And then what happens is the graft itself will just stick out. The tip will stick out, and that little bulb will grow the follicle in 3 to 4 months. When we do a multiple follicular unit graft, we use a slightly bigger instrument to accommodate the slightly bigger graft. So what we'll do, once again, is we'll take that, and we'll measure it to the depth of the follicle. So that way it's a perfect fit, so we don't, once again, cause any structural damage or any additional damage to the scalp or tissue, because it's a perfect fit for the graft itself. The 1-hair grafts go in the frontal hairline, and that's what gets it super soft and natural. The little 2 3-hair grafts will go behind that frontal hairline, and all the way back in that center portion, that's where those multiple follicular grafts will go. That will be dispersed with little grafts between and around it, so that way they'll be completely undetectable.
Throughout this procedure, I had absolutely no discomfort, no pain, just a mild pressure, exactly what Dr. Bolton had explained to me, and absolutely exceeded my expectations. I can't imagine how anyone would have any hesitations to doing this. The time just flew right by, and I mean, just the people that were working here made me feel so comfortable, so at home, and Dr. Bolton is certainly the most professional person I've ever dealt with. So was 10 days after my surgery, and it's hard to believe that I actually had this procedure done. I feel exactly like I did before I came in. The surgery was amazing. The results are phenomenal. Everything that Dr. Bolton and his staff has told me has come true. There was not one thing that was off the mark. The follow-up was absolutely flawless. I think I was most impressed by everyone in the office, everyone calling me every day just to say, how is everything going? Are you comfortable? Did the surgery, meet your expectations? Honestly, it exceeded my expectations, and I'm so glad that I went with Dr. Bolton.